things. MRI is not working. CT scan is not working.
Minister of Health, Komnaminta Akando, a taking mover. We are applauding him. Yes, this is the way to go. This is the way to move a nation. This is how to put some people on their toes to work. The minister no ekwasra Greater Accra Regional Hospital. Air rate, one money, impromptu, and other call. And guess what happened? A lot of things happened there. And this is how it's supposed to be. All the sectors now, Eshawu ministers now, then you know say yes, Omo ye juma and Omo ye juma. This minister and then Okosram Bridge Hospital and guess what happened? Guess what happened? Even their washroom is not working. Their washroom are patients at a hospital, a whole regional hospital. A whole regional hospital. Washroom is not working. And they have taken it for granted. Their MRI is not working for 2 good years. For 2 good years. And oh my God, what is wrong with a black man? What is wrong with this nation? What is wrong with our country?
It is a country. Never cost woman who they simply. And they are fought. It started from the 90s. And me a bonny and a man fun for your monkeys. And what is song it is a country?
This nation. What is wrong with our country? Ghana. The country called Ghana indeed. CT scan is not working for 2 good years. This is what we are living in this country. Yanko have video. Yanko have video. Time a minister Ekwasom hospital one without their notice. But as an ebekon, high luminal sub channel, this is the critical eye media. Mino AD. Me and Bedi Media Dom, Bedin edit of Benfo class, message, and then first time I'll subscribe. Now I'm joining. Now was watching our comment section. Where my obisu any actually.
I can imagine a patient in the facility who wants to use the washroom.
Minister, will show you. No, the washrooms are actually I'm a clinician. I work in the space.
So that's why it's locked down. Yes. So what about the ones on the other side? That's for PDs. That's for PDs. Let's see that one. We are just going at random.
No, but Reverend, come. You know, when was they locked? Yesterday.
Yes, please.
So it means that if anybody wants to...
Just called me this morning.
The facility manager was around.
Yeah, the faculty manager is around. That's what's going on.
Yes, he brought us here. So what's going on? You are not even aware this one is locked. No, you are not.
So, like you said, we are going to work on it.
And when we met you there, you said that's why you brought it. So you couldn't even tell us at that time that
this one.
Where is it? Is it this one? What is this?
This particular washroom.
So I don't have access to it.
I don't have access.
So unless they open it for you.
And so you must know, you are in charge. So you must know the development here.
Right.
If it is faulty, you must know.
Right.
So what it means is that today, as I speak to you now, all these patients, if they want to go to washroom, what would they do?
We have one suggestion that they can
Let's go.
So just imagine, so Omoya was a minister no ever. Like they will put things in place. A quite be on my first washroom no on a quite be on my first washroom no and come by no day on. Now another one is that their MRI is not working. Their CT scan is not working for 2 good years. And also minister a question on confrontation in a question why is it not working for 2 good years? A whole regional hospital. You can honestly video near but another video so far. Oh, we are in your account farm. Yeah, the bedroom.
For almost 2 years. This one.
Okay. So they are not working.
Yeah, this is part of this. They are not working. And this is part of what is
So this, I remember during the transition period, there was a particular program which sought to suggest that all these machines have been fixed.
If you remember,
This is ours.
and the other one we stepped as a backup. And we have another one that we're going to maternal. That is not good. So this is the and the river one is a backup. This is a backup.
But which one is functioning now? You have a unit that is functioning.
No, we are now trying to set up.
Okay, that's not.
We don't have the facility doesn't have
That's the question.
So what happens if somebody needs that now?
So for the background, right here. when the hospital was when the hospital was as part of the IC, you have some dialysis issues that you can do more dialysis, all the things that you need. Then along the line, the manager treatment with the dialysis unit that is our so they have something. Now, because hospital wants to infrastructure definitely. So and the attached to IC. But then the other place was for what is that other place? It's just outside. The one that is mentioned. The private. So no problem.
So for these 2 good years, MRI engagement and CT scan engagement, patients in info na and there's a social media, social media, all the comments now, they are blasting the hospital, they are blasting the doctors, they are blasting those in charge because they have what it takes to fix this issue, but they have sat down. This is what is going on. We don't know. And it's our area, Oko Hospital, they have to refer you to another place. No, we don't know, say hospital, a yomodia, and a yomodia, a penny be there, and a penny be there. We can't tell. They know, they can tell. They can tell. They will be in the best position to tell. This is what is going on. Now, after the inspection now, Minister Emeki, the last comment I'll make here, young has a comment nearby, the critical idea at the back, analysis near Cassania and say, video.
This is not the rage we handed over to the former administration. I must be very honest with you. This is not the rage hospital we are all boasting of. This is not the rage we made so much noise about. And rage must go back to its glory. And we will ensure that. What has changed is a typical, I've told you a lot of things. MRI is not working. CT scan is not working. And you were with me. I asked them to take me to the washroom. We walked more than 2 kilometers looking for a washroom. So that is true. During the transition period, we read certain documents to the effect that there was a program running, that program was supposed to fix all these equipment. But later in the report, and then further to ascertaining the truth ourselves, we realized that it was to the contrary. It's clear. In the handing over notes, they will tell you Global Fund is doing this, Gavi is doing this, Kofi is doing this. And as part of one of them, I remember that they said these facilities or these equipment had been fixed. But unfortunately, that is not the case.
CT scan, MRI. Machines now, as a hospital, I'm not sure on him. Then I want more found. Directors now in hospital, you must study some bay and answer a government in our own face. This is the question. 2. here some machine for scanning any diagnosis for the doctors to diagnose them and you find an hospital bank and an reform too. We have to do investigation. So any of faults though if say a fault are fine. But here said they say here that's almost faces I when machines in an fixing. We have to do something for them. So I said they say I am fixing machine, normal fixing there, then there must be a punishment for them. This is the black man on our day. This is the politician on our day. Or you are the walk outside. Politician Yaris here on the moment in back outside. Now me know me, yeah, aha, and a better. It's him say for 2 good years now, machines in asylum, now hospital on way then. Obi ya no me here some machine then on the diagnosing. This is the question. Politicians always take us for granted. And why I said it, this is the simple question. And why I said it. What is wrong with this our country? A black man born bad will always be born bad because our mindset, maintenance is our problem. Maintenance. You best nice hospital. The hospital almost see the that today, not even more than 10 years, hospital, the state of the hospital, washroom keke crumble, patients in the bar, and if I'm and also a problem. This is the mindset of a black man. Applying for Eduma almost saying, maintenance is our problem. How can we develop a nation without thinking ahead? How can we develop a nation without thinking of maintenance? Because at the end of the year, a best we are punishing. We are those in charge. We don't punish them, so they will also always be relaxing. Yes, and Miss Adam, and then papa, and then mammy, but on another property there, or back to baby, no, I fell. I say, when I could trust scan or how could be a pharmacy baby, no, I catch yourself, or how could you do? Or how could be a hospital baby, no, I catch yourself, no one ever show. This is a black man, and these things are going on in this country. It is going on. It is not a news. But they have seen it, but they are doing nothing about it. Yeah, they have seen it, but doing nothing about it. Black man, it is time to think better. It is time for us to think ahead and to develop this nation, to think about the ordinary citizens. Obi no babeme broni akosi broni na adwene de ono ode ya de patchen bia no onim say ade we assent ma me replace because onipa de se no behia. This is the mindset of a white man but not a black man. Let us develop the nation. It is for us, not for individual. Join the comment section, I the critical idea, and then when I also any idea, watch out for the next video. Best subscribe to the Luminary Sub channel. Now click on notification button and video get to us when you watch.